And again, welcome to all of you out there online and through Facebook that are joining me here now. It's about a minute before the top of the hour. At the top of the hour, we'll get going. But let me just briefly share with you this. We're going to go through three things tonight. After a little bit of an introduction, I'm going to share with you the most common types of arthritis pain. Now, there is a broad range of arthritis, but almost all of them fit under one of three labels or types of arthritis pain. We're going to talk about all three of those types with special attention to one of them because it's easily the most common. That will lead us very easily into topic number two, which is, okay, I know what type I might be dealing with, but now what really causes it? So we're going to talk about the three most common causes of arthritis-related pain. And then that will lead us into topic number three, what in the world can you really do about it? And during that point and in the introduction, we'll talk about how most of the things that we are given to combat arthritis and really any musculoskeletal condition are not true solutions. They're just ways to mask the issue. And so we're going to talk about our real solutions that get to the root of the problem. And so I'll let the cat out of the bag right off the start here. If you want long-term solutions, you need to find and fix the root cause. You can't just mask it with a treatment that doesn't get to the root of the problem. So there you are. That's it for tonight. And it is 7 o'clock and it's time to start. So I am going to share my screen with you. I'm going to share screen 2. First, you're going to see a little picture of my son. Now, there you go. You should be seeing my screen now. It says the truth about, no, that's the wrong one. We're not going to talk about the knee tonight, are we? I don't think so. Let's try this again. I think I got it on the wrong one. There we go. Looks very similar to that, but we're going to talk about relieving arthritis pain without medications, without injections, and without surgeries. So I want to tell you that it is important to me that we have an opportunity to interact as much as possible. So I'm going to alert you to the fact that at the bottom of the screen, you're going to find a chat button there. If you click on that chat icon, it'll open up a little message box. You can put any message in there. Zoom will give me a little alert that there's a message that comes through. So if you have questions, send them my way. I'll do my best to get to all these questions, but I promise to answer all of them. If not live during tonight's session, I'll get to you one-on-one through email or something like that too. So we want this to be as interactive as possible, but sometimes it's hard to get to all those things. So I'm going to do my best with that. I am also going to share with you my personal contact information. So at the very least, you can see me tonight as a resource for you as you seek solutions for arthritis-related problems. So you can feel free to contact me after the workshop and do it that way too. All right. Why in the world would you want to listen to me? Well, that's a good question. Let me tell you just a little bit about myself. I'm a veteran of 25 years as a physical therapist, a proud graduate of the University of Iowa's physical therapy program. That's a program that consistently gets ranked in the top 2 or 3 in the nation. So it has a great reputation. And I felt like it really prepared me well for meeting the needs of lots of people with a variety of musculoskeletal issues. And I'm thankful for having gone through that. The reality is, though, what we're going to talk about tonight are things that you learn in the trenches, things that I've learned from working with people over the course of 25 years in an outpatient physical therapy environment. And I think that's a unique perspective that I want you to understand a little bit better tonight too. My company is called Kinetic Edge Physical Therapy. We've been around since 1998, and I've actually been with this company for 21 years now. We have 7 physical therapy clinics in central and south central Iowa. And we see, first of all, musculoskeletal issues are easily about 90 to 95% of what we do. It's somewhere in that range. Low back pain is the #1 issue, and then shoulder pain, and then shoulder and neck pain are tied for second, and then knee pain. Those are our top ones. All of those at their root have to some degree some arthritic issues, unless it's a younger person dealing with a traumatic related injury. So arthritis is an underlying condition of a great majority of the people that we see in our clinic. And it's not just me. I'm one of 23 physical therapists in our practice, and then we have occupational therapists and a variety of assistants and athletic trainers and exercise specialists. And I think what's unique about what we do at Kinetic Edge Physical Therapy is that we really understand well and appreciate real functional movement, okay? So there's a time to be on a table doing something, but that time has to transition into being on your feet. You exist between gravity and the ground, and your body is a part of a dynamic system that's impacted by everything that's going along or going around it, on around it. That includes other parts of your body. Your hip is impacted by the knee below and the low back above, for example. And when one thing doesn't do its job well, another thing has to compensate for that. And then it's also impacted by the environment that we are present in. And so gravity and the ground and all the forces acting upon us. What you get at Kinetic Edge Physical Therapy is a really good understanding of how to make your body cooperate well with itself and all its dynamic parts and the environments within which we have to function. And we're proud to do a really good job with that. Now, you might be asking yourself, is this really a workshop I need to be at? Well, let's try to figure out if this is right for you. Most people who deal with these kind of conditions tell me that they finally raise their hand and ask for help, seek advice, go see an expert because they recognize that they're not capable of doing what they want to do as well as they used to be able to do it or as well as they want to do it. Okay, so if you're finding that you're less capable and becoming a little bit more dependent upon others, you're not alone. And that's a big reason why people come to this workshop. This workshop is for you if you're saying that. If you're starting to ask tough questions like, man, is this issue ever going to go away? Is there really anything I can do about this? If you're sick and tired of spending a lot of time, energy, and money on stuff that doesn't really work, this is a great place for you to be. If you've gotten so desperate that you're saying, man, maybe I just need a surgery. I didn't want to do that, but doggone it, if it's going to help me, I'm going to go for it now. If you're at the end of your rope, this is a great place for you to be tonight. And some people even ask really deep questions like, man, if I can't do this now, what's it going to be like in the future? And how is this issue going to impact my overall health? And you will learn a lot tonight about why this issue is really important for your specific arthritic condition, but it's much bigger than that. It's much more about full body function than anything else. One of the truths we're going to talk about is that let's say you have knee arthritis. Well, your knee doesn't exist in a vacuum. It's impacted by its closest neighbors, okay? And this is a truth that's true of us as a people too. We, for better or worse, influence the people that are closest to us, right? And we are influenced by those that are closest to us as well. We know that when we hurt, it's hard to be in a good mood. It's hard to have a positive influence on others. And so if you're finding yourself being a little bit more short with people, being sick and tired of being sick and tired, this is a great workshop for you to be at because you know that you want to do better care for yourself and your family. And then finally, if you said, well, I've tried a bunch of stuff, even medications, but I'm feeling side effects with that stuff. Yeah, that's one of the trade-offs with that. And again, those medications you'll learn, they can make you feel better for a little while, but does it truly get to the root of the problem? It doesn't. And so if you're just saying, I want to find a natural way to be able to move better, move more comfortably, move more often, this is the place to be. And I'm happy that you're here if those are issues that you're dealing with. Now, there might be some people who are forced to be here. That happens from time to time. Or they're saying, hey, maybe there's this simple thing I can do and snap my fingers and make it go away. I wish I could teach you that. I really do. But there is no quick fix for this problem. And I think you'll understand why in short order here tonight. These issues don't have to be extremely complicated, but they're not take a pill, rub a salve on it, and make it go away. It's not the way these things work. These things have developed progressively, and our approach to making them better has to be a progressive approach as well. And so if you're like, well, I don't really want to do anything to make myself better, and believe me, I understand that. This is probably not the place for you to be though, because it doesn't take a lot, but it takes something. So that's something. It doesn't have to be complicated. Just we usually tell people a simple approach done with consistency usually works. And so we're going to talk about that. What does that approach look like? Okay, So I'm going to ask some questions. This is where I'm asking for a little feedback. So for all of you online, all of you on Facebook too, you can remark in the comments here. How do we know if what I'm going to say is going to be helpful to you? Well, first of all, tell me, what kind of arthritis issue are you dealing with? And what I really want to know is this: is there something that you do that makes that arthritis issue worse? Okay, think about the difficulties or the pain that you've experienced because of this arthritis for the past several weeks. And what's the thing that kind of sets it off? Is there something? Tell me what that is. And then finally, these last two questions are interesting. They don't tell me if this approach will be able to help you, but it might tell me a little bit about how long it's going to take. If you've been dealing with this for decades and your pain gets up to a 6, 7, 8 out of a 10 pain or worse, that's a little bit farther along. We're going to talk about this thing called the cumulative trauma pathway. And the farther along you are, the longer it takes to make it better, but it can still be changed. It just takes a little bit longer. Okay, we're getting some comments here. Left thumb, but it can be very painful. Yeah, even the smallest joints can be really painful. Someone else is saying they have RA. We're going to talk about RA. You'll even learn what RA means in just a little bit. And the upper cervical area had a fusion, now having some nerve issues, compressing. Okay, there we go. And getting some PT at Kinetic Edge right now. Okay, Judy, well, you're going to get some good information to share with your therapist here. Anyone else that wants to share anything, I'm definitely interested in hearing that. So go ahead and make your comments. Cheryl's talking about it being at her back. That's a really common area. This might sound funny, folks. Got another one coming in. Hips give me so much problem. Lower legs go numb. Lupus for 20 years, now diagnosed with RA. Okay, now we're going to talk about some arthritises that are rheumatoid in nature. That's what RA is. We're going to talk about others that are more wear and tear and mechanical in nature. The mechanical ones definitely have a movement component to it. The RA has a systemic issue to it, but it's still impacted by movement-related issues. And so it all boils down to movement. We're going to talk a lot about movement. Mary says facet arthropathy in the lumbar spine. Okay, you're using fancy names like you've been around some medical people for a while there, Mary. Get to level 8, it's best just 5. Stiffness and soreness in the morning, carpal tunnel surgery in both hands, says Michelle. Okay, interesting stuff. Now, let me tell you this. I asked you the question, is there something that makes it feel worse or really works it up? And most are going to say, yeah, there's something. If it's a weight-bearing joint, being on your feet usually is problematic. Those kind of things. If it's an upper extremity thing, using those extremities can be problematic. If it's hand-related, gripping and grasping tasks, pinching tasks, those kind of things can be problematic. It doesn't make a difference what it is. If there is something that makes it worse in a kind of a weird way, that's actually not bad news. Because we know that if your pain, your arthritic issue is reproducible, it's also reducible, okay? So let me hear this again. If your pain's reproducible, it's not necessarily the worst news in the world, because that which is reproducible is also reducible. We're going to talk about that concept in a little bit. We're going to talk about what arthritis is, how to manage it naturally, and what approach do we need to take to have effective treatment for arthritic-related issues. We're going to talk about those root cause issues. But let me tell you a little bit of story about trauma. Okay, you've heard me say a little bit ago, the cumulative trauma pathway. But let me tell you this first. When you hear the word trauma, what do you think of? What comes to mind? When most people hear the word trauma, they usually think of things like a motor vehicle accident, right? Or falling from a height and having damage, significant damage to a bone or to a joint. Yeah, that's trauma for sure. And that actually is a specific type of trauma called acute trauma. So look at my graph here. We have tissue damage severity on the vertical axis, time and expense on the horizontal axis. I want you to see what acute trauma looks like. This is acute trauma. Something causes change to the tissue immediately. And then as time goes by, because we're organic beings, we get better. It slowly improves. Okay, so these acute issues are definitely realities in some people's lives. Okay, most of the issues, particularly with arthritis-related issues, however, are not acute in nature. They are more cumulative in nature. And yeah, so Mary talks about a motor vehicle accident in March, so that can definitely cause some acute trauma. Oftentimes, those acute traumas are followed up by normal wear and tear stresses, that create a cumulative issue on top of an acute issue. Osteoarthritis, says an OP engineer tonight. Osteoarthritis, again, we're letting the cat out of the bag here, but that is the most common type of arthritis. And if that's affecting a big part of your spine, almost any movement you're going to make is going to have some impact on that, because you can't splint your entire spine when you move, right? So, yeah, now that osteoarthritis in particular is most often not an acute issue, but a more gradual, cumulative, progressive issue. And that looks different than acute trauma. This is gradual increases in tissue damage over time. Now, what you just saw took a few seconds on the screen. Okay, but in life that might take years, if not decades. And for a while, the first part of this, you were experiencing some changes that you weren't even aware of because you hadn't hit the symptom threshold. Okay, stuff can change and we're not even cognizant of it because it hasn't registered as any type of discomfort at all. Now, once it crosses the symptom threshold, we start to feel it. In most cases, people will tell me if they think back to that time when they first began to experience it, they would say, well, it was there, but it wasn't so bad. I could feel it, but it wasn't as intense. It would come and go. But as time goes by, it's becoming more intense and it lasts longer, and it doesn't take as much to kind of work it up, and it takes longer to kind of recover when I start to experience this stuff. That is the very nature of cumulative issues. What's interesting is cumulative issues, if left unchecked, are definitely going to worsen. And so what we're going to talk about is how do we not leave it unchecked? In other words, how do we truly check and fix those conditions? That's what the bulk of tonight's topic is all about. But I first want to tell you the story. Why in the world did I have these two buckets on there? Well, this is the cumulative trauma analogy that I think hits home for a lot of people. Think about it. You're a bucket and you're filling water with everything you do your entire life, okay? You get a little water in your bucket, and the first thing that we're going to notice is fatigue, okay? So I'm 50 years old. I've been a physical therapist for half my life. Being a physical therapist is a really enjoyable job. It's not physically demanding usually, but I can tell you at the age of 50, I'm more tired at the end of the day, at the end of the week than I was when I was a 25-year-old rookie. My body is changing. I am aging. I've got water in my bucket, okay? So fatigue's normal, and people experience that regularly as they age. And we recognize it's normal, so we don't really do anything about it. We just try to keep going, right? We don't do anything about it. We ignore. We just put the nose to the grindstone and go. And then eventually, in many cases, more water fills the bucket. And as that water accumulates, the symptom changes. It's not just fatigue anymore, but now people begin to experience stuff like stiffness and soreness. Sound familiar? Okay. This is not pain, but it's just not comfortable either. All right, it's discomfort. So again, people say, well, yeah, I don't want to be a squeaky wheel. It's definitely worse than it used to be, but it's not that bad. I'm going to be okay. So we just keep going, and we keep doing the same things to our bodies, and more water fills the bucket. And when it gets close to full, it's not just stiffness and soreness anymore. It hurts. It's painful. It's a different level altogether. Okay. Now, the good news is we're still not quite to this major tissue damage issue, but we're getting close. And as soon as it spills out, we got a mess to deal with. And so what we're talking about tonight is what we can do to move in that direction, to get rid of some of the water in our bucket, to create margin between the top of the water and the top of our bucket, because the bigger that margin is, the better we function. And there are ways to do that, which we're going to talk about tonight. But that's the path. That bucket analogy tells us the path that we're on. Look at my the back of my screen here. See, we're on a railroad track. See that on your screen? If you look in the distance, rounding the bend, coming towards you, is a train. Now, if this is real and we were truly on these train tracks, we'd be getting signs that there's danger in our future. We'd be starting to feel the rumble of the tracks of it originally. And as it gets closer, we might start to hear something in the distance, maybe a distant horn is sounding, and the rattle gets bigger. The closer it gets, the symptoms are more significant. This is cumulative trauma. But instead of all these things you might hear when a train's coming your way, your body's giving you signs and symptoms as this cumulative trauma progresses, where your discomfort and pain becomes more frequent and more intense and longer in duration. That's the cumulative trauma pathway. And unfortunately, when we experience more and more of that, higher levels of cumulative trauma, we start to move less. And like I said earlier, that's problematic, not just from an arthritis standpoint, but from a general health standpoint as well. What do I mean by that? Well, let me tell you this. There are 6 things. Americans spend about, I think it's 86% of our healthcare dollars on these top 6 things. 5 of those 6 things are directly impacted by how well and how often we move. And if arthritis is telling us, hey, we better not move because that bothers me to do that, what's that going to do to those things? Musculoskeletal issues are number 1, easily. And if we move less and less often, less effectively, our arthritic issues, our musculoskeletal issues are definitely going to worsen. Number 2 is heart disease. That's made worse if we move less or move worse. Okay. Number 4, I'm skipping number 3 for the moment. Number 4 is diabetes. Number 5 is obesity. Number 6, depression. All of those negatively impacted by poor movement habits. Number 3 are cancer-related issues. And there are some cancers that are influenced, for better or worse, by movement, but not all of them. So I'm just leaving that out. If we do something about our arthritic-related issues, we reduce our risk for further arthritis problems. We also reduce our risk for these other cumulative health conditions of heart disease, diabetes, obesity, and depression. So we're talking about a pretty big and important topic here tonight, one that should get your attention. And I'm trying to get your attention because I want you to understand that how you've responded up to this point is totally understandable, but probably not effective. Okay, so what do I mean by that? Tonight I'm in my office, but I live down the street a few blocks in a home that was built in 1915. We moved in several years ago, and our insurance company came and looked at it and said, yeah, we'll insure you, but not that roof. That roof needs to be replaced. The shingles are horrible. And I looked around inside. It's a big roof, by the way. I looked around inside, didn't see any issues developing. So I'm like, it's going to be expensive. I'll get to it, right? But what did I really do? I ignored it. And I ignored it. And I'm thankful to say that I didn't ignore it too long. We got it fixed this past about a year ago. It was expensive, but I tell you, it would not have been nearly as expensive of me ignoring it to the point where eventually something worse happened and I would have spent a lot more money. So if you're here tonight, you're probably not ignoring it anymore. You're looking for solutions. And when you get to the point where you realize, hey, it's not going away, we are going to look for solutions. As I've said earlier, most of the solutions that we are presented aren't truly effective because they don't get to the root of the problem. They simply try to mask the problem. And so we're going to talk about the most common treatments of medications, injections, and surgeries. Again, I don't want you to hear what I'm not saying. They can be necessary and important, but they aren't solutions. Okay, they're symptom reducers. They don't fix the problem. They simply help you manage it. And all too often, at a cost that can include side effects. And if they're not necessary, why do them? So I'm challenging you tonight to not just mask the problem and spend money on something that temporarily makes you feel better, but to find and fix the root problem and truly solve it. That's where we're going tonight. And you can't do that unless you understand this key point. Almost all these issues at their core, or at least are influenced by this one key point. This is not necessarily a medical issue. It's a mechanical issue. Okay, what do I mean by that? Okay, so think about this. If you are told, well, I have inflammation, there's something that's inflamed, what's the natural tendency? Hey, we got something for that. Inflammation needs an anti-inflammatory. Take the anti-inflammatory, the inflammation goes away, we feel better. And there's truth to that. But we're going to talk about why inflammation isn't necessarily the enemy that we think it is. The enemy is really the quality of movement. And if we don't move well, we might take something that is a mechanical problem and try to treat it medically. You can't treat a biomechanical issue with a biochemistry treatment. It's not going to get to the root of the problem. These are movement-related issues by and large. And unless you fix the movement problem, you're not going to get the solution that you're looking for. So again, I don't want to get deep into the weeds on this, but I want you to understand that there are 4 phases of healing that occur when tissues get damaged, okay? And number 2, look at that, from day 3 to day 20, about day 3 to the end of week 3. After we have an irritation or an injury to a tissue, we're going through the stage called inflammation. Okay. Now, again, remember, inflammation usually tells us take an anti-inflammatory, take an anti-inflammatory. But these are the normal, natural phases of wound healing. Inflammation is a normal, natural thing. We've been equipped, we've been created. God has given us this gift of inflammation. And this is the phase within which we are developing the matrix that will turn into, eventually, over time, vascularization that feeds that tissue with blood and therefore all the nutrients that we need to be healthy. Okay, inflammation gives way to proliferation and granulation, and eventually to full maturation. And at the point of full maturation, we've got a matured framework of blood vessels that can feed that tissue the nutrients that it needs. When tissues don't get the nutrients they need, they are more susceptible to damage and continued problems that worsen and worsen and worsen as time goes by. And so I would tell you an anti-inflammatory can temporarily make you feel good, but it can be fool's gold, okay? Because it doesn't allow you to experience the true healing. One of my favorite authors from many decades ago, C.S. Lewis, he was a contemporary of J.R.R. Tolkien. Tolkien wrote the stories that turned into some major motion pictures, Chronicles of Narnia and those kind of things. C.S. Lewis has lots of books, and I love him. In World War II times, he wrote an essay called Miracles, and I'm going to give you a brief quote from that essay. He says in that essay, the magic is not in the medicine, but in the patient's body. Okay? Your body is the magic, not the medicine. And if we're going to do treatment, and what he's talking about when he says treatment, effective treatment, what does effective treatment do? It either stimulates what nature is supposed to do, or it removes a hindrance so that nature can do its natural function, okay? So again, think about that through the lens of an anti-inflammatory. Does an anti-inflammatory stimulate nature's functions? It does not, because inflammation is a natural function. It stops, it hinders, it creates a hindrance. It doesn't remove a hindrance, okay? So I'm encouraging you to do something that facilitates what the body is designed to do and stop being insane. Okay. All right. So let's talk about arthritis, and that'll lead us into types, causes, and treatments. When we talk about arthritis and we talk about the different types, I want you to understand that I'm not telling you about what's causing it at this point. We're just simply describing it. A diagnosis is a description. It's not a statement of cause. Okay. We need to understand that arthritis, a Latin term, it literally means joint inflammation. Arthur, that's joint. Itis is inflammation. But this joint inflammation, arthritis, is an umbrella term that refers to all different types of joint inflammation. Osteoarthritis is the most common type of arthritis. I know that some of you on here have rheumatoid arthritis, and there's something also called psoriatic arthritis. Those second and third types, RA and PA, are autoimmune. There's a systemic issue at play here. And so there are some medical interventions that are necessary for managing those conditions. There's also mechanical issues, movement-related issues that need to be managed to fully embrace what you need to do to be well, function well, and feel well, even when you have a systemic condition, RA or PA. Certainly with osteoarthritis, movement-related issues are paramount to success in long-term treatment. I also want you to understand this, is that we treat arthritis like a dirty word, but we have come to understand that arthritis is normal and natural. It's a normal part of aging, okay? It's as normal as having wrinkles on the skin, okay? Tissues change as time goes by. And the good news is, and I want you to hear this loud and clear, we're gonna hear this several times tonight, because you have arthritis does not necessarily mean that you have pain. Because you've been told that you have arthritis, because they found evidence of arthritis, does not mean that that is the source of your pain. We're going to talk more about that in a little bit. And we know this because there are tons of people, more people than those that have pain, are people walking around with arthritis that don't know it. They have arthritis but don't have pain. Wouldn't that be a great thing? Well, that can maybe be you too. Let's talk about osteoarthritis. That literally means bone and joint inflammation. Osteo is bone, arthur, joint, itis, inflammation. Some stuff that I found online. It affects 20% of the US population, 30 million people in the United States. I think that's totally false. I think it's greatly underestimated. And we know that because more and more research is telling us that tons of people have this that we don't know. And we don't know it because they don't have pain and haven't had a diagnostic test. So I think 20% of the population is dealing with uncomfortable arthritis, diagnosed arthritis that's been diagnosed because they've had pain and had diagnostic tests to support that diagnosis. Okay, look at this. These are findings amongst people of different age groups, 20s, 30s, 40s, 50s, and so on, in the spine. See that top line, disc degeneration, degenerative changes to the disc. Amongst 40-year-olds, 68% of 40-year-olds have this, and it's not just 68% of 40-year-olds. These are all asymptomatic people. So COVID has taught us what asymptomatic means, right? These people don't have back pain, but 68% of 40-year-olds that have no back pain have disc degeneration. Okay, 50% of them have a disc bulge. 18% have degeneration of a facet. I know one of you talked about facet joint related issues. You can see as age goes up, the likelihood goes up, but remember, these are all asymptomatic people. Okay, so there's a ton of people walking around that have all the same things that you've been told you have, they just have pain. Why do you have the pain? Well, let's figure that out. We're going to talk about that a little bit. Osteoarthritis risk factors, some are modifiable, can be changed, others cannot. You can't make yourself younger. If you have a previous injury, that makes you more susceptible to osteoarthritic changes as time goes by. That's what I said earlier. Acute trauma is then followed up with cumulative trauma. It becomes a layered issue with that. Females are more likely to have arthritis-related issues than males. You can't change that. Some other more modifiable factors, your weight, your muscle strength and mobility, other chronic conditions like diabetes. Remember, those are all movement related, or at least impacted by our ability to move, how often and how well we move, okay? Smoking has an impact on that. That's a modifiable risk factor as well. The most common joints you can see that have osteoarthritis, most of them are weight-bearing joints plus the shoulder, okay? And the signs and symptoms are usually stiffness, reduced range of motion, and swelling. You can have observable swelling in those joints, okay? Let's take a look at two hips. The one on the left is a healthy hip, okay? Nice, pristine cartilage, articular cartilage on the ball of the ball and socket. You can see a nice space between the ball and the socket. That all looks really nice, very pristine. Most people don't have hips that look like that. If you're 35 or older, your hip does not look like that, I guarantee it. The one on the right is an artist's rendering of an osteoarthritic hip joint, where you can see the articular cartilage is starting to erode, and it's drawn in red because it's irritated and inflamed a little bit. It wouldn't literally be red if you looked at it under a microscope, but artists, of course, use the color to depict things, okay? But I want you to understand this. This is much more normal than this is, okay? Arthritis is so common that most people walking around, even those without pain, have it and don't know it. Okay, let's talk a little bit about RA, rheumatoid arthritis. This is an autoimmune disease. It's much more common in the smaller joints. So instead of, your knees and your hips, you're talking about all the littler joints in your hands and in your feet, the mini wrist bones, much more susceptible. You're going to see a change maybe in the finger position if you have these issues. Usually these conditions get diagnosed. Rheumatoid gets diagnosed between the ages of 40 and 60, but there is a juvenile version of this, of course, that can come on earlier. Because it's a systemic autoimmune issue, it impacts more things than your joints, your eyes, your cardiovascular system. General fatigue is a really common complaint amongst people with RA. Again, there are medical issues that play with RA because it is an autoimmune issue, and therefore it may require some specific medications to deal with the autoimmune nature, but those medications don't get rid of or improve the movement-related components. There's still a movement-related component that needs to be dealt with. What about psoriatic arthritis? You've heard of psoriasis, of course. You've seen enough commercials to know what psoriasis spots on the skin look like. For those that have the more significant types of psoriasis, they'll have changes to their nail beds. that usually precedes arthritic related issues. Only 10 to 30% of the people that have psoriasis end up having arthritis related to that psoriasis. And this is usually diagnosed in a relatively young age. Most people are diagnosed before the age of 40 because they've had all these spots, they've been doctoring for that, and then they know, hey, I'm starting to get these joint aches along with this. Again, it's an autoimmune issue. You need to certainly consult with physicians to find the right balance of medications to deal with that medical component. But movement is still a component that needs to be dealt with, and most medical doctors don't deal with that component. So movement and exercise is the key. Now, I want you to hear a few misconceptions as we talk about all these types of arthritis. I know a couple of you have already been told, hey, you have bone-on-bone issues going on. We're going to talk a little bit about that. I would say bone-on-bone is an overstatement at least, and you'll learn why in just a little bit. Some people say, well, I have arthritis. I'm destined to a lifetime of problems. I can't do anything about it, and I probably need to just have surgery to make it better. All of those are misconception as well. Some people will say, hey, my joints have always made a lot of noise. I must have arthritis-related issues too. No, that's not necessarily the case. Some people just have noisy joints, so that doesn't necessarily correlate at all with arthritis. What about this one? It's just destined to get worse. It's progressively going to get worse. And I would say that's definitely a misconception. Again, I want to give you a source of hope by telling you there's more people out there that have the same issues as you that have no idea that they have those issues because they haven't been diagnosed. They don't have pain. So therefore, they haven't had diagnostic tests, and they don't know that they have spinal arthritis or knee joint arthritis or hip arthritis. So it often gets progressively worse, but it doesn't have to necessarily. Let's look at this healthy knee joint. This is just one example of a joint. This knee joint, when you look at it under an X-ray, you're not going to see the soft tissues, but the relationship of bone to bone tells you there's a lot of space there on both the inside and the outside of this joint line. Adequate joint space. That joint is surrounded by something called a synovial membrane. Inside that synovial membrane is synovial fluid, and that synovial fluid is mostly water. So I can tell you one of the best things you can do if you have arthritis is drink lots of water. Pure liquids like that are very helpful at improving joint movement, joint cushioning, and reducing inflammation in those joints. This healthy joint's likely going to have full and complete range of motion. And I will tell you at this stage, this knee has good friends. The hip above it probably moves really well. The ankle and foot below it probably moves really well too. It's a part of a dynamic system where all parts are taking care of business and doing their jobs well. Okay. Now let's look at arthritic. See right here, we've got the lateral aspect of this knee joint looks pretty good. The medial aspect looks pretty good. Now we've got a lateral aspect that's pretty decent. Knee on the medial, loss of space. In fact, the person there is often going to be told, boy, you probably have bone on bone right there. Okay. What about this hip joint? The hip joint on this side has a nice degree or amount of joint space. Not the case on this side. That bone and that joint have much more contact surface in that case. If you look really closely, there's a little bump there that would be evidence of some osteophytes or bone spurring that's occurring in that area. When there's less joint space, we know there's probably a breakdown of some of the cartilage in that area. So a loss of some cartilage. But I want you to know that the picture does not tell you the whole story. In fact, the picture can give you a really inappropriate story. Okay. And what do I mean by that? I think that's maybe on my next one. Here we go. This is the MRI of pain-free people in the disc. You can find that with 20, 40, 60, and 80-year-olds, the preponderance of all these changes are really, really common amongst pain-free asymptomatic people. Okay. This is true in the low back, at the knee, at the ankle, at the neck, at the shoulder, all over the place. Lots of asymptomatic people have arthritic changes. Okay. It happens all over the place. So if you've been told that you have arthritic changes, it's not a death sentence, it's not a life sentence, it's pretty normal. It's pretty normal. And that pathology that you can see does not equate to pain. That pathology likely pre-existed any discomfort you are experiencing. And if we find ways to take the stress off that joint, mechanically remove the stress in the joint, it'll feel better, but that pathology won't go away. It'll still look that way. It's all about how you function, how you move. It's not what it looks like under a picture. Let's talk briefly about bone on bone. If you've been told this, I want you to be, I want you to rest assured this ain't the end of the world either. Okay, so let's say if you have been told your knee has bone on bone, well, first of all, the knee wouldn't move because bone on bone means there's a mechanical block there. So you might have a loss of joint space, which limits the motion, but it's not going to be bone on bone that stops the motion. Fractures occur when we have 800 pounds of force on a bone. Okay, now if you weigh 200 pounds, every step you take, you probably have 800 pounds of pressure at your knee or close to that. And if you start to jog, more than that. So if you truly have bone on bone, you'd be having fractures really easily in that area. It's not the case. Our joints are created with capsule around it and fluid within it and ligament to support, and that creates, it's like a floating structure on suspension. Okay, so that creates space within the joint, and that's normal to have that. And that space is increased if we have plenty of fluid within the joint. That's why drinking water is so important. And if we continue to move and feed ourselves with things like movement and foods that help reduce inflammation, that's really important. Okay, but if we start to get a loss of that joint space, there is a little bit more friction, in some cases some tension, that leads to mechanical changes and inflammatory response, which makes us tempted to take an anti-inflammatory, right? But remember, the inflammation is normal. It helps the healing process. And if we can find ways to move well while not taking an anti-inflammatory, that's likely better for you. And I want you to also understand that it's really not your joint's fault. If it starts to break down, it's probably the closest neighbors. Remember that? You impact those closest to you. You are impacted most by those closest to you. Same true in your body. If you have low back arthritis, the hip below, the thoracic spine above, those two close friends we have to look at closely to find out, are they doing in synchrony and in concert together what they need to do, or is one part not doing its job, putting more mechanical stress on another part? Let's talk briefly about the typical cycle of arthritis. Okay, the first thing we notice when we have arthritis is some kind of pain. Usually it's fatigue, discomfort, and then pain. And that pain then causes us to think twice about doing the things that cause the pain, so we do less. We move less, and because we do less and move less, we start to gain more weight, which creates more mechanical compression, which leads this cycle just gradually worsening as time goes by. And this is a cumulative process. What we're talking about today is a way to break that cycle. So we're focusing on movement as a way to break the cycle. But there are other things related to weight and pain management. Again, pain management, I want you to understand, can be helpful temporarily, depending on what interventions are used, but it's not the solution. It might be part of the solution. And I also want you to understand this. Our joints are made to absorb forces. So pressure on joints is normal. It's just that when the pressure exceeds that symptomatic threshold and then continues to occur, cumulatively, it leads to that point. That's when we got to do something about it. Okay? Right. So we've talked about the most common types: osteoarthritis, rheumatoid arthritis, psoriatic arthritis. Let's talk about the most common causes. Okay, now, for a moment, I'm going to talk about the treatments. Not sure why it's right here, but it's all right. We'll do this. If we're talking about what we do about this arthritis, recognize that the most common treatments are not necessarily the most effective. Medications, injections, and surgeries are easily the most common treatments. But if we understand that the root problem is related to movement, we're not getting to the root with any of these things. And so don't rely upon these. These certainly shouldn't be your first defenses. And we also know that, so for example, people that have joint replacements because of a really significant arthritic change, maybe some of you are in that boat already where you've had joint replacements. Unfortunately, we get to the point where that's unavoidable in some cases. But we also know that even though people have had these surgeries, that doesn't mean that it always eliminates their pain. People that took pain medication before these joint replacements, many of them continue to require pain medication afterwards. That tells us it's not just about what's going on at that joint. There's a bigger issue at play here. So don't just rely upon medications. We also know that opioids can be really effective at reducing pain, but they are dangerous. And the opioid epidemic has been made only worse, unfortunately, by COVID and the fact that we haven't been able to get appropriate treatments, and it's just a big problem. Surgeries hold a lot of promise, but they're not great. There's lots of surgery research that shows that doing surgeries for an arthritic issue doesn't really bring about positive change. The British Journal of Medicine did a big overview of all the research on arthroscopic knee surgeries and have found that the outcomes are no different than doing nothing. So they don't recommend them anymore in Britain. Sham knee surgery, this has actually been done at various joints where there's arthritic changes. What they do is they introduce a scope, and half the people, they do something to kind of clean up the ugly cartilage tissue in there, and half of them, they don't do anything. And they look at what people experience in terms of pain and function after the surgery, and the results are no different if they had true arthroscopic surgery or just the introduction of the scope with no work being done to the cartilage itself. And then steroid injections, research shows that it doesn't enhance function, it doesn't reduce pain. It actually makes you more likely to have greater loss of cartilage and therefore more likely to have surgery in the future. Okay. All right, so if those common treatments aren't typically effective, well, let's talk about the most common causes of arthritis, so then we can go into those true solutions. When I talk about the cause, what I'm saying is, what is the real culprit here, okay? And so when we're talking about different kinds of arthritis affecting different body parts, we're looking at 3 key movement links in our body. We want to know that your hip is doing what the hip is supposed to do, that your thoracic spine and upper torso is doing what it is supposed to do, and then down below at the spot where the body meets the ground, when we're operating on our feet between gravity and the ground, it's the ankle and the foot. Again, I don't want to go deep in the woods on this, but look how the body is put together from foot up. Okay, the foot lands, and that creates a chain reaction that affects the knee and the hip and the back and the shoulder and so on and so forth. And what we find is that at the ankle and the foot, we typically have movement issues whereby we have too little movement. It gets tight, okay? At the knee, it gets too mobile, and we need to stabilize it. At the hip, again, we need to move that thing. At the low back, we need to stabilize. At the thoracic spine, we need to mobilize. And so we're looking at the 3 most common areas that need to be mobilized when we talk about your ankle, foot, your hip, and your thoracic spine. Those are the 3 most common mechanical culprits for issues that you deal with related to arthritis. Now, in our world, we talk a lot about Goldilocks, okay? So think about this. Goldilocks told us not too hard, not too soft, not too hot, not too cold. It's just right, right? Remember that story? Now think about this from a joint perspective. Your hip joint is made to move a particular way. Every joint moves 3-dimensionally, and we need to have a balance between mobility and stability. It's not healthy when the joint gets too mobile and lacks stability. That's a problem. If your joint is too stable and lacks mobility, that's a problem too. We need to have the just right. It's a funny word I use called mostability, mobile stability. Mostability. Okay, so when a hip moves too much or moves too little, it's going to have consequences elsewhere, and the closest neighbors are the areas that usually pay the price. So I would tell you this: if you have low back pain and arthritis issues there, and you've also had knee issues, the common denominator for your low back and your knee is your hip. Okay, so again, letting some of the information out of the bag. Actually, that's good timing to talk about that. Think about the positions that we're in today compared to generations past. Generations past, we were very active on our feet doing. It was laborious. It was agriculture. We were always moving and doing. Okay. Now today we have technologies that allow us to sit behind desks and look at our computers or be in vehicles a lot. We're in this hip flex position as we sit a lot. And you see all these muscles here, the muscles called your hip flexors. You can see they start at your spine, they start in your pelvis, go to your upper leg there across the hip on the front side of the hip. When those muscles are in a hip flex position, they are shortened. And so it's really common for those muscles to get tight in today's generation. And then when we stand up, it's going to change the position and posture of our pelvis and our low back, and it changes the forces that act upon the tissues above and below that area of tightness, your knee below and your low back above. And if you lack the appropriate mobility there, it's the hips problem because the hip's tight, but that's the area that's paying the price and compensating for that usually wears out, that usually has arthritic issues that cumulatively turn from fatigue to discomfort to pain. Those are the areas you need to fix by fixing the root cause at the hip. Now, in some cases, the hip can be too mobile. There can be weakness in the stability of your gluteal muscles. Some people, we have to work a lot at that. The point is this: you don't want your hips to be too mobile. You don't want your hips to be too stable. If you have any of those extremes, we need to get you to the most stability middle, where there's a balance of mobility and stability. And if the hip can do its job well, the low back above it, the knees below it aren't compensating for that. What about the thoracic spine? Okay, you can see on this, the thoracic spine has the rib cage connected to it. You would think by nature it doesn't move as much, and if you think that, you would be right. It does not. The thoracic spine doesn't move as much as the cervical spine or neck above it. It doesn't move as much as the lumbar spine below it. But I'll tell you what, it needs to do what it needs to do. So do this for a moment. Slouch. Okay, you don't hear therapists say this much, but slouch. Now stay slouched and try to rotate to your left as far as you can. And now try to rotate to your right as far as you can. Okay, now sit up nice and tall and do the same thing. See how much farther you can go. When you get flexed like that, other motions are lacking and we get locked down and other things need to carry the load. Lack of most stability at your thoracic spine means your lumbar spine below, your shoulder and your neck above are compensating for poor movement in the thoracic spine, and tightness of the thoracic spine is exceptionally common, very common. Hip tightness, hip weakness, thoracic spine tightness are really, really common problems that when fixed, reduce mechanical or movement-related stresses at arthritic joints, meaning you can move better and feel better, and you're not going to make the picture or the diagnostic test look any better, but the symptoms go away when you take the mechanical stress off that issue. The ankle and the foot is the same. The foot's supposed to adapt to the surfaces that we put it on. Okay, it's made to unlock and then lock us. We propel ourselves, but the feet don't always do that job well. And if the foot doesn't do the job it's supposed to do, if it's too mobile or too stable, well, the links of the chain above it, the knee, the hip, the low back are compensating for that poor ankle foot function. And so this is a common issue that gets overlooked when people are dealing with arthritis related problems. And so here's another example to pick something off the ground. We know we're supposed to bend at the knees, right? But a lot of people don't, and they don't because they can't. Maybe they're tight at their ankles. Maybe their knees don't allow them to do that. So now I got to move at my back. My back's not made to move that way. Those movement stresses have consequences that lead to a wear and tear phenomenon, cumulative issues that gradually and progressively worsen and become more frequent, more intense, and longer in duration as time goes by. Little things add up if we don't find and fix the root problem. And so here's the bottom line. If you've dealt with arthritis-related issues, whether it's osteoarthritis, rheumatoid arthritis, or psoriatic arthritis, and you've sought doctor's help, and you've gotten medications, injections, maybe even surgeries, and you're saying, I'm still hurting, I'm still having problems, it hasn't fixed it, okay? Maybe you've even gone to a physical therapist before, but they didn't look holistically at how all these parts work together. You've missed something. You maybe missed multiple things. You need to understand how your hips work, how your thoracic spine works, and how your ankles and feet work so that all these parts can do their work in equal responsibility to take the additional stress, compensation-related stress off the tissue that's crying out for help, giving you those signs and symptoms that say something's wrong here. Okay, get rid of that inflammation, not by taking an anti-inflammatory, but by changing the movement at that part, by finding and fixing the root cause. And here's another issue. There isn't always a root cause. There are sometimes root causes. More than one area, mechanically or movement related, that needs to be fixed. You need to find and fix those things. And so that makes this next section really easy to successfully treat it. you got to find and fix the root cause, okay? So I'll remind you, injections, medications, surgeries, really common, don't get to the root of the problem. Cost money, and you still have same arthritic issue at play. The mechanical issue hasn't been resolved, you're still going to have issues. So instead, address the dysfunction. Find the root cause or the root causes. And so to do that, it needs to be an individualized approach where the person assesses movement at all these parts and how those individual parts contribute to this collaborative movement effort, okay? So there's not 3 best exercises for back arthritis, because that back arthritis can be caused by any number of things. There's not a magic set of exercises to do, but there are exercises you need to do. And those exercises that you need to do are determined upon what your true dysfunction is. Where's that root cause coming from? And you have to recognize that your area of arthritis is not existing in a vacuum. It's evidence that there's wear and tear, okay, because you're hurting, but you haven't found the issue. You got to look beyond the area of pain. You got to think holistically, our whole body, have a global perspective, which means looking beyond the site and the source of the pain, okay? The process should be educational and empowering. And really what I mean by that is what you do day 1 is really important on day 1, but you probably should be doing something different on day 14 because your body changes and you need to challenge yourself as time goes by. So the successful treatment empowers you to do the right thing at the right time to get the desired effect that's necessary today. And that's a process, okay? It is legal for us to work with multiple people at the same time. We don't do it, and I don't recommend that you have interventions that way because that's not individual. We need to do what you need to do today. And what you need to do today is not the same as what you did last week. And it can be very hands-on, but it should be functional. Ultimately, your body exists between gravity and the ground. And so if you're not doing stuff with your foot on the ground, we haven't taught you how to interact in the real world. We need your area of arthritis to collaborate really well with all the moving parts around it within your body, and then dealing with your environment, which is gravity and the ground and all things around. Makes sense? So remember that cumulative trauma pathway showed progressive damage. It might take months and years to develop. Well, once you get above that symptom threshold, if you find the right solution to take stress off that tissue, it's going to get below the symptom threshold. There's still going to be tissue changes, but it's not going to be to the point where it's a chronic issue. It's manageable, okay? And I also want to say this. If it is arthritic-related issues, these movement issues are really, really important. But the secret weapon isn't just one weapon, okay? It's a multifaceted approach. Healthy weight and getting to that healthy weight in a healthy way. I'm not a dietitian, but I love getting good counsel from good dietitians who teach us that what we eat has an impact on the inflammation that we experience in our bodies. And so I think everybody that experiences arthritis should consult with a dietitian to learn what foods are healthy for them, reduce inflammation, and what foods are unhealthy for them and increase inflammation. I can tell you this, the highly processed foods that Americans are accustomed to are not good for long-term arthritic health. That's for sure. And then supporting your joints, which is all about getting stronger. Research shows that moderate strength reduces mechanical stress at the joints. So you don't need to be a bodybuilder and look like Atlas, right? Or Arnold Schwarzenegger at his prime. But good foundational strength goes a long way to support your joints and reduce any discomfort they would feel in that area, especially if you can support your joints by finding ways to move well throughout the entire kinetic chain, okay? You've learned a ton tonight, folks, but we still have some problems here, right? First of all, you're not gonna retain all this information. All of our memories are limited, so you're not gonna retain all this information. You still, though you've heard a lot of common causes, the most common causes of arthritis pain, you still don't know what your specific cause or your specific causes are, okay? And we like to say knowledge is power, and that sounds really good, right? But knowledge has no power if we don't implement it. So if we're gonna go in the next step with this thing, if you're really looking for true solutions to your problem, we need to find out what your specific issue is or issues are. And then we need to get beyond just the knowledge and tell you what you can do about it so you can implement something, okay? So the solution really is get to the root of the problem. Find the right tools, do the right thing at the right time, and the same cumulative issues that created this progressive cumulative traumatic problem, when done in reverse, are unspun, and good repetition brings about good results. Time can work in your favor as well. And so what I want to offer to you is this natural arthritis pain relief consultation. That's my gift to you. What is this? It's 20 minutes with one of our arthritis experts. And in that 20 minutes, they'll ask you questions, get some open-ended answers from you about those questions, and do just some good brief assessment techniques, looking at those major parts that we talked about. What's going on at your ankle and foot? What's going on at your hips? What's going on in your thoracic spine? Okay. And in just 20 minutes, you'll know what type of arthritis you're likely experiencing. You'll understand what the primary root causes are in your specific situation. And then we'll introduce to you what a process to make it better looks like. Okay. And at the very minimum, what you will get is confidence, direction, and some hope. Okay. So the benefits are a multitude. You can stop wasting time and money on things that don't get to the root of the problem. Okay. It'll give you alternatives to learn how you can actually take control of your situation. Instead of seeing time work against you, have time work in your favor. And you can avoid all the side effects of medications and the risks related to surgical procedures. And you can implement the unique solutions that you need to have an impact. This has a $150 value, but I'm giving you a gift. We are going to do this for you if you sign up tonight for no cost whatsoever. You get that time absolutely free. And in fact, we're going to give a guarantee. We're not charging you, so we can't give you a money back guarantee, but we'll tell you this. If you go through this assessment and you say, well, I didn't learn a thing, that was a waste of my time, just tell us that. And the $150, the value of that time, we will put into the charity of your choice. We love helping local charities, and we've done a lot of that, and we're thankful for that. But I'm happy to say that no one's ever taken us up on this guarantee because it's easy to live up to this. It's very valuable to spend time learning about your unique issues. And so I'm going to encourage you to do that. In fact, I'm going to encourage you to do that right now. If you want to take advantage of this, simply click on that chat button and say, I'm in, I want in. Okay, that's all you need to do. And if you do that tonight, we'll give you a call and we'll get you signed up at a time that's convenient for you. In early January, our schedules get a little bit looser, but they're getting heavier now. So I'd encourage you to sign up tonight. Otherwise, it's hard to get in. We can get you in if you let us know tonight. We've got some times set aside for this. If you want to do it, I want you to tell me, yes, I'm in, and then tell me what clinic you want to do this in. So listen up. We have clinics in Ames and in Des Moines, in Newton and in Colfax, Pella, Oskaloosa, and Centerville. Okay, so put down I'm in, and I want to be in this clinic. Now, if you're not located conveniently to any of those locations, we can do this online too, so you can just write down online. But I will tell you this, a few years ago, I wouldn't have been so bold about this, but I've worked with so many people who've sought help for so long and end up being disappointed. And they haven't got the common sense application that they need to really take control of this situation. The research shows that only 10% that would benefit from this information get it. Only 10%. So the system is causing way too many people to fall through the cracks. They're not getting the help that they need. And so we're providing that for you tonight. And so I am encouraging you to take advantage of this. It's absolutely free. You get to spend 20 minutes with an expert at no cost and no obligation, and you will know what the cause is, what the type is, and what you can do to get long-term relief from that issue. Now, I also want you to hear this. It isn't snap your fingers and it's good. It isn't do this one thing and your pain is gone forever. It's not like that at all. It's going to take a little time and effort. It's not hard stuff, but there's a cumulative process that has to be done to overcome this cumulative process. And I can guarantee you this. If you do the things that take the movement stress off the tissue that's crying out for help, the frequency, intensity, and duration that gets worse with cumulative issues will start to work in your favor. I can definitely say by doing this, your pain will become less frequent, less intense, and shorter in duration. Whether it goes away entirely, I don't know. Your condition may have been around too long to get complete resolution. but we can do something about it. Now, here's my name, my number, 641-780-6330. This is my email address. You can have that too. All these emails you've been getting from me as a reminder after you signed up, if you signed up for the Zoom thing, you can reply to that if you want to ask any questions too. I'm going to stop the share. I know many of you have been. Okay, so let's get in this. We've got OP Engineer says he's in, he or she, I guess. Tell me what your first name is and which clinic you want to be in, OP Engineer. Maybe you did that later. Ann wants to be in Pella. We'll get you in Pella. Judy in Des Moines. Judy, are you the one already seeing us in Des Moines? If so, talk to your therapist and let them know you want to do this. They probably already looked at a lot of this stuff. Cheryl is in. She wants to do online. Cheryl, we will get that. Stephanie in the Des Moines area. Great. There we go. OP Engineer in Des Moines. If you would, OP Engineer, give me your first name. We'll cross-reference it to your sign up and get you contacted that way to find a time for you. Mary, we're going to get you hooked up in Des Moines now too. There's lots more on here, guys, and I'm going to encourage you once again, take advantage of this. Okay, Tony, we will get you. We'll get you contacted, Tony. Thanks a lot for that. So it's no cost, it's no obligation. It's silly. Listen to me this long and not learn how to personalize it. So I want to encourage you to consider that. It will be worth your time. Jim and Mary, both. You want both to go through it? We can do that, Jim and Mary, and that would be in Des Moines. I'll have our Des Moines care coordinator call you and get you both set up for that. That would be great. Anyone else before I take off here? Now, I want you to know you're going to get another email from me in an hour or two. It will have a link to this video, so if you want to watch it again, you can. If you know people that are dealing with any kinds of musculoskeletal issues or arthritic issues, send them this email, give them that link, let them watch this. We need this word to get out. There's too many people. Ann, okay, very good. Is he doing therapy with us, Ann? And if not, we're welcome, or we're happy to see him too. So just let us know what his name is, Ann. I lost my train of thought, but oh yeah, you're going to get that email from us. So forward it on because, like I said, only 10% of the people that would benefit. Yeah, so get it to them. Let them hear that information too. There will be a link on there where you can actually sign up for an injury screen if you want that. But if you give me your name already, do that. Yes, you're welcome, Nancy and Howie. Appreciate your time too. Mary just wants to listen. My husband is. I haven't. Okay, there we go. You're listening and here with your husband to support him. I got it, Mary. That's great. And again, on that email that you get later tonight, you can reply to that. That'll eventually get to me. If you've asked questions tonight I haven't got to, as I promised, I will get to them. So I'll send an email your way too. If you're on Facebook Live, I'll get to those things too. It's been great to spend some time with you. Tracy, okay, we got you in Des Moines. Very good. We'll do that, Tracy. Thank you. Yeah, thank you to all of you too. It's an honor to spend time with you. It's been a blessing to me to do that. There we go. I know that your time is valuable. So the fact that you gave some to me tonight's good. And I mean what I said earlier, even if you don't take us up on this offer now, I want to be a resource for you. So reach out to me. You got my contact information. Reach out to anyone at Kinetic Edge. If they wear the Kinetic Edge brand, they know how to look at this stuff, and the same thing that I've taught you, they will know and be able to implement as well. So proud of my team. They're a wonderful group that understand this really well. Helped a ton of people, but we know that even though we're helping a ton, there are so many more that need it. So we want to get that word out there. So help us if you would, spread that word, and reach out directly if you have any further questions. Have a great night. Blessings to you all.